Talking about a medical condition that is related to the gallbladder today, which is basically acute choledocholithiasis. All right. So in acute choledocholithiasis, we will not be discussing it haphazard. We have it arranged. We'll talk about the definition of the acute choledocholithiasis. We'll talk about the symptoms of this medical condition. We'll talk about the risk factors of this medical condition. Talk about the complications, we'll talk about the diagnosis, we'll talk about the treatment options, and we'll talk about the self-care. All right, this has to do with the patient, okay, how they will treat their self, okay, after they have been diagnosed with acute choledocholithiasis. All right, so acute choledocholithiasis, let's move. Choledocholithiasis is a condition where the gallstones obstruct the common bile duct. Okay, so if this is the gallbladder, okay, if this is the common bile duct, and there are basically some stones, okay, from the gallbladder, but they will not obstruct the gallbladder. This is because the gallbladder is so large, do you understand? But the bile duct now being a very small passage, these stones will actually block it, okay? So these stones will block it, and this is what we call choledocholithiasis. So it's a condition where gallstones obstruct the common bile duct, which is a small tube that carries bile from the gallbladder to the intestine. All right. So these gallstones can pose a risk by blocking the flow of bile. All right. So if bile is supposed to follow from the gallbladder down to the small intestine and it is blocking it here, then you know that it is a risk factor. Okay. It is blocking the passage of the bile. Now, this blockage can lead to pain, it can lead to inflammation, it can lead to potential serious complications, right? So let's delve into the details of this choledocholithiasis. The symptoms include you might have fever, all right? You can have pain in the right upper quadrant, okay? This time you guys should already know the 9 quadrants of the abdomen. So the right upper quadrant, you have pain there because that's where the gallbladder and the common bile duct is located at. Then jaundice, yeah, jaundice, you can have jaundice. You have yellow coloration of the eye, yellow coloration of the sclera, yellow coloration of the skin too. Nausea and vomiting. Nausea is like the feeling of vomiting, while vomiting is actually expelling your abdominal contents. So yeah, what are the causes of choledocholithiasis? I didn't bold this, so I felt it was an all-round symptoms. So what are the causes of choledocholithiasis? When there's high cholesterol level in the body, it causes choledocholithiasis. If there's high bilirubin levels in the body, it causes choledocholithiasis. If there's insufficient emptying of the bile by the common bile duct, maybe the juice, that's the bile juice, we get to like precipitate, okay, because it has a lot of calcium in it. All right, forming stones, and these stones will get to block the common bile duct. When there is also inadequate bile salts, it can also cause choledocholithiasis. Now, what are the risk factors of the choledocholithiasis? It includes an inactive lifestyle because, of course, you need bile for the digestion of food. So, if bile is not being carried to the small intestine, there will be problem. There will be rapid weight loss because you need this food to be digested so that it can absorb the nutrients so that you can grow properly. Okay, so if these nutrients are not being absorbed appropriately, then you have a rapid weight loss. There's prolonged fasting, there's obesity, there's okay, okay. Okay, I think this side now they are trying to talk about okay, I think this one was supposed to be divided, right? So this one is okay, divided from here, okay? So this is us talking about the group of individuals that are at risk of having choledocholithiasis, right? So if you have prolonged fasting, sorry, this was a mistake, all right? If you have prolonged fasting, you are at risk of having choledocholithiasis. If you're an obese person, all right, if you are a pregnancy patient, you have um, risks of having choledocholithiasis. If you have a low fiber diet, if you have a high calorie diet, if you have a high fat diet too, you're at risk of having choledocholithiasis, right? So okay, let me just use this image again. So basically, if there's blockage in the common bile duct, okay, that carries bile to the small intestine, then you have a condition called choledocholithiasis, right? What are the complications of choledocholithiasis? If left untreated, choledocholithiasis may result to what? Hepatic abscess. We said that gall obstruction can result in pus formation and abscess, okay? There's a pancreatitis. You said that accumulated gallstones may cause inflammation of the pancreas. All right. Now, what is the diagnosis of choledocholithiasis? We said that diagnostic tests include CT scan, lipid profile test, bilirubin test, ultrasounds, magnetic resonance cholangiopancreatography to visualize the bile duct and the pancreas. Okay, so these are like, okay, you suspect this, but this is basically like from history taking an examination. So you need some machine to actually observe the internal environment of the body, so that you can further um, confirm that it is choledocholithiasis, okay, that is going wrong. So what are the treatments or options? We said that surgical procedures such as laparoscopy, that's minimal invasive removal of gallstones, lithotripsy, that's reducing the gallstone size, sphincterotomy, that's incising to remove gallstones, okay? So these are the common surgical procedures used to treat acute choledocholithiasis. What is a self-care? Okay, um, if you are at risk of having choledocholithiasis, or if you have choledocholithiasis already, what is a self-care? What are some things that you do so that this disease condition is actually reduced? You should avoid junk food. All right, you should consume nuts with unsaturated fat. Don't consume saturated fat, and follow a healthy diet. Cut down on carbohydrates, exercise regularly, and increase your water intake so that you don't have accumulation of chemicals, you don't have body fluids precipitating in your bodies. Now, what are the specialists to check out if you have uh, choledocholithiasis? They call them gastroenterologists or hepatologists, okay? These are the ones that are specialized in treating choledocholithiasis, all right? So guys, that's it about the disease condition. We spoke about the symptoms, we spoke about the causes, we spoke about the risk factors, we spoke about the complications, diagnosis, and treatment, okay? So that's it, and see you guys in the next tutorial. Bye for now.